This is a really interesting area. So hypermobility, it's a word that probably when I started in medicine we hardly used really. We talked about having loose ligaments, but now that strictly speaking we'll talk about criteria for diagnosing someone that's hypermobile. So the great thing about being hypermobile is it often gives a child great ability, but they are at more risk of injury. And so if a child is diagnosed or said to be hypermobile, then I think that it would be really important to touch base with a physiotherapist and actually look at the components of their hypermobility where they might be at risk. So it's about motor control and strength. So if their stability and strength are poor, then they will be at greater risk of injury. So what we need to do is actually look at a program that strengthens that child prior to going into the sport. Now sometimes there are definitely children who there's a thing called Baton's criteria. They might have 9 out of 9 criteria that are positive for hypermobility, and in that situation rugby might not be the game for that child. I know rugby's amazing in that it's a sport for all sizes and shapes, and that's one of the most incredible things about it, but certainly there are some children with hypermobility that might be at more risk, and I think those decisions should be made by a medical professional where you can actually start to guide them into other sports.
And I would suggest as a physio, it's very easy for a mum to grab son or daughter, take them along to a physio. The physio then will have a checklist that they'll run through and see where that child lies on that checklist. If we decide if by that checklist there's no significant hypermobility, the physio will also go on to check their shoulders, to check their knees, their hips, to have a look at their balance, their proprioception, their ability to change direction in a safe way. And once again, you can have that discussion with the parent about whether rugby is for them. Having said that, if I had a child and I was worried that they had a significant amount of hypermobility, one of my first things I would be doing is sending them to a sports physician who is then able to clear a number of other things with the parent and also discuss maybe more appropriate sports if they are significantly hypermobile. Physios will then go on to target particular areas like their shoulder strength, functional strength, the way that they change direction, and really importantly, the way a child lands on one leg and 2 legs. In rugby union, thanks to Sharon, we've got a injury prevention program which has been shown in the research to be incredibly successful at reducing the risk of injury. A program that can be implemented and should be implemented by the coach 2 to 3 times a week, so in warm-up for training, in warm-up for the game, for these kids to practice the right technique in landing and changing direction, for them to develop some specific strength in areas that are at risk.
Yeah, absolutely. And I think the big points there are the ability to land and to cut with good technique means we're not dropping at the knee, we're not dropping at the pelvis, and those motor patterns increase the risk of injury. So if we start practicing those early, then I think that will decrease our risk of injury. That warm-up strategy was initially introduced in soccer worldwide, and they've done massive amounts of research and showed that they've decreased the risk of injury by for lower limbs, over 60%, for ACL injuries, like over 50%. It's been in a different format. It's been reproduced in Bath in the UK. It's a program called, theirs is called Activate. It's shown a reduction in the rate of concussion as well, and some of that is to do with, again, it comes down to a whole body movement, balance and landing type program, and also hamstring strengthening program. From my perspective, having been at rugby at a higher level, what obviously ideal patterns and programs start often in a professional arena, so we've always screened our players, and we would find deficits in the screening that we would then work on, and we would correct those through their professional career. the idea of this warm-up program is we identify those deficits when a child is young, when a child is 12, and they start those same exercises which our professional athletes are doing at a lower level early. And we introduce it as a warm-up because everyone has to do a warm-up, and often coaches might they really want to train their players. So if they can be given a warm-up strategy, then the players can learn the warm-up strategy, and then the coach can concentrate on organising his session for that night. So 2 to 3 times a week can really make a difference.
I would also suggest that for our female athletes, it's particularly important, isn't it? Because female athletes have a higher rate of injury. So particularly for the girls, it's essential that coaches learn this, and there are a number of resources. There's online resources through New South Wales Rugby, and we know through the other sports they've put it in the knee program in netball. There's the soccer program, the 11 and AFL have a similar one. But they're very, very easy to learn. They're spelt out online and very easy for coaches to download.